CNA Practice Test questions and answers.
The nursing assistant knows that the responsibilities of the position do not include
A.
helping a resident to bathe,
B.
administering a medication,
C.
keeping a resident's room tidy,
D.
applying an ice pack as ordered. Correct answer, B. Administering a medication. Nursing assistants may not administer medications. It is not within their scope of practice. Only RNs, LPNs, and other properly licensed personnel may give medications. Which of the following would be considered an example of battery toward a patient?
A.
The nursing assistant cleans the resident's glasses.
B.
The nursing assistant asks for permission before touching the resident to assist them to the bathroom.
C.
The nursing assistant bathes the resident without his or her permission.
D.
The nursing assistant keeps a resident isolated from others as a form of punishment. Correct answer, C. The nursing assistant bathes the resident without his or her permission. Bathing a resident without his or her permission is an example of battery. Keeping a resident isolated from others as a form of punishment is an example of involuntary seclusion. The nursing assistant suspects that a resident in the facility is being abused due to multiple unexplained bruises, refusal to answer most questions, and refusal of ADLs. Which of the following actions should the nursing assistant take next?
A.
Notify the nurse assigned to care for the patient about the bruises.
B.
Report the suspected situation to the nursing assistant's immediate supervisor.
C.
Ask the resident repeatedly to identify an abuser.
D.
Wait for more proof in order to identify the abuser. Correct answer, B. Report the suspected situation to the nursing assistant's immediate supervisor. Abuse in nursing facilities, or even suspicion of abuse, should be reported immediately to the nursing assistant's supervisor. This requires more intervention than the nursing assistant's scope of practice covers. Waiting or notifying the nurse only about bruises may delay getting the resident help. MRSA is an example of which of the following?
A.
A resistant strain of bacteria that is difficult to treat with antibiotics.
B.
A bacterial strain that is easy to treat with antibiotics.
C.
A mnemonic to remember how to act if there is a fire in the facility.
D.
A set of activity guidelines designed to keep residents safe. Correct answer, A. A resistant strain of bacteria that is difficult to treat with antibiotics. MRSA stands for methicillin-resistant Staphylococcus aureus and is very resistant to most antibiotic treatments. What is the best way for a nursing assistant to prevent infection?
A.
Use standard precautions when caring for residents.
B.
Apply an antiseptic hand rub before and after caring for residents.
C.
Wear gloves when in contact with body fluids.
D.
Frequent hand washing. Correct answer, D. Frequent hand washing. Frequent hand washing is the best way to prevent infection without a doubt. The other measures are supportive. Which of the following is a key part of care when administering a bath to a resident?
A.
Clean the perineal area of a patient before assisting them to clean their face.
B.
Use cool water when bathing the patient to promote better circulation.
C.
Allow participation in care to promote a sense of independence.
D.
Perform all care for the resident in order to conserve their energy. Correct answer, C. Allow participation in care to promote a sense of independence. Allowing the resident to participate in care will raise their self-esteem and allow autonomy. It is inappropriate to clean the perineal area before the face, or to use cool water rather than comfortably warm water. A nursing assistant cares for a resident. Which of the following skincare measures are correct?
A.
The nursing assistant does not begin perineal care until a second staff member is present.
B.
The nursing assistant notes an unblanchable red area on the resident's sacrum and reports it to the nurse.
C.
The nursing assistant applies talcum powder beneath the abdominal folds of the resident.
D.
The nursing assistant applies a prescription ointment as ordered. Correct answer, B. The nursing assistant notes an unblanchable red area on the resident's sacrum and reports it to the nurse. It is the duty of the nursing assistant to report any red pressure spots on the resident to the nurse. The nursing assistant may not apply any prescription ointments. Talcum powder is not recommended. A second staff member is not needed for perineal care. Before shaving a resident, the nursing assistant checks for which of the following items in the resident's care plan?
A.
Shaving instructions related to problems or issues clotting.
B.
History of a heart condition.
C.
Presence of the resident's razor from home.
D.
Any previous refusal of ADLs. Correct answer, A. Shaving instructions related to problems or issues clotting. It is necessary to check the shaving instructions in the resident's plan of care to be aware of any problems clotting and the necessity of using an electric razor as opposed to a traditional one. Fecal impaction may present with which of the following symptoms?
A.
Dark urine.
B.
Excessive flatulence.
C.
Small, watery leakage of stool.
D.
Abdominal pain. Correct answer, C. Small, watery leakage of stool. The watery leakage of stool around a blockage is the most specific sign of fecal impaction, also known as a bowel obstruction. Dyspnea is a term that refers to difficulty with which of the following?
A.
Urinating.
B.
Breathing.
C.
Defecating.
D. Swallowing.
Correct answer, B. Breathing. Dyspnea is a term that refers to difficulty with breathing. Which of the following statements is true about Alzheimer's residents?
A.
An increased appetite is common as Alzheimer's progresses.
B.
Residents can never be reoriented because they will immediately forget it.
C.
The resident may become confused, but hallucinations are never a part of Alzheimer's.
D.
It is important to maintain a routine to avoid confusion and overstimulation. Correct answer, D. It is important to maintain a routine to avoid confusion and overstimulation. Maintaining a routine is incredibly important to Alzheimer's patients. Hallucinations and a decrease in appetite are common. It is important to frequently reorient the patient. Which of the following is a correct aspect of making an occupied bed?
A.
Place soiled linen on the floor until the bed has been remade with clean sheets.
B.
Lower the bed to the lowest level when the procedure is complete.
C.
Avoid raising the bed rails unless absolutely necessary.
D.
Mitering the corners of the new sheet is no longer recommended. Correct answer, B. Lower the bed to the lowest level when the procedure is complete. Lowering the bed to the lowest level is important for safety. Mitering the corners of sheets is recommended, as is raising side rails. Never place soiled linens on the floor. Which of the following is an example of a pulse rate that should be reported to the nurse?
A.
45.
B.
98.
C.
82.
D.
64. Correct answer, A. 45. Any pulse outside the range of 60 to 100 should be reported immediately to the nurse for the resident's safety. The nursing assistant knows that signs of hypoglycemia include which of the following?
A.
Tachycardia.
B.
Polyuria.
C.
Hot and dry skin.
D.
sweating. Correct answer, D, sweating. Sweating, as well as confusion and tremors, are signs of hypoglycemia. Which of the following guidelines regarding residents who are hard of hearing would be considered correct?
A,
Encourage family participation to make sure they understand you.
B,
Speak in a high-pitched voice to enhance understanding.
C,
Write down words rather than speaking.
D,
Speak clearly and slowly as you face the resident. Correct answer, D. Speak clearly and slowly as you face the resident. Speaking slowly and clearly is the key to helping hard-of-hearing clients understand what you're saying. A resident is ordered to be in high Fowler position for each meal. Which of the following descriptions is the most accurate depiction of high Fowler position?
A,
The patient lies on their stomach for 20 minutes prior to eating.
B,
The patient's bed is at a 30-degree angle with the patient slightly slumped over to the left.
C,
The patient's bed is at a 60-degree angle with the feet propped up.
D,
The patient's bed is at a 90-degree angle and the patient is positioned sitting up. Correct answer, D. The patient's bed is at a 90-degree angle and the patient is positioned sitting up. High Fowler's is a description of the patient sitting straight up in bed, meaning the bed itself has to be at a 90-degree angle to support them. What protective equipment should be worn when changing an incontinent patient?
A,
Gloves and gown.
B,
Mask and gown.
C,
N95 masque.
D,
Gloves, gown, and a mask. Correct answer, A. Gloves and gown. The nursing assistant should wear a gown and gloves at most as correct contact precautions. Of the following symptoms, which one is most likely due to an infection in a resident?
A,
Pale skin.
B,
Tented skin.
C,
Sudden onset confusion.
D,
Aphasia. Correct answer, C. Sudden onset confusion. Infection, especially in older clients, tends to cause sudden onset confusion. Tented skin may be normal for an older client, as could pale skin. Aphasia could indicate the onset of a stroke. The nursing assistant knows that the term NPO means
A,
bed rest only.
B,
No oral temperatures are to be taken.
C,
Nothing by mouth.
D,
Liquid diet. Correct answer, C. Nothing by mouth. NPO is a Latin abbreviation that stands for nil per os, or nothing by mouth. It indicates that the client is not allowed food, fluids, or oral medications. The nursing assistant should tell the nurse if the client with diabetes
A,
does not touch their lunch tray,
B,
reports numbness in their feet sometimes,
C,
combs their hair without being prompted,
D,
decides not to finalize a will. Correct answer, A. Does not touch their lunch tray. Someone with diabetes should always eat regular meals to keep their blood sugar relatively stable. Numbness in the feet is neuropathy, a common side effect of diabetes. The nursing assistant knows that residents on bed rest must be turned every
A,
2 hours,
B,
1 hour,
C,
6 hours,
D,
8 hours. Correct answer, A. 2 hours. Residents on bed rest must be turned every 2 hours to maintain skin integrity. Which of the following pulses will be most commonly used by a nursing assistant when acquiring vital signs?
A,
Popliteal,
B,
radial,
C,
brachial,
D,
femoral. Correct answer. B. Radial. The radial pulse is the most easily accessible location to take a pulse. The nursing assistant is helping residents to eat in the dining room when, suddenly, a resident stands from their seat and begins clutching their throat while coughing silently. The nursing assistant performs which of the following actions first?
A,
Ask the resident if they're choking.
B,
Call 911.
C,
Begin CPR immediately.
D,
Begin the Heimlich maneuver. Correct answer. A. Ask the resident if they are choking. It is important to first assess whether or not the resident is choking. If they are able to answer, air is still moving through the trachea. If they nod yes, but are unable to speak, it is time to begin the Heimlich maneuver. The Heimlich should not be performed on anyone who is able to cough or speak. A client at the facility receives a new roommate. While the roommate is in the bathroom, the client leans toward the nurse and whispers, "Why is she here anyway? Is she sick?" The best response by the nursing assistant is,
A,
"I'm not sure. Let me take a look at her chart."
B,
"Why don't you ask her yourself?"
C,
"She's here for the same thing as you."
D,
"I'm afraid I can't share that information with you." Correct answer. D. I'm afraid I can't share that information with you. HIPAA requires you to keep clients' health information confidential. Period. A client with Alzheimer's wakes up more confused than usual one morning. The nursing assistant knows that after breakfast, it is most important to support normal gastrointestinal tract function by
A,
recording intake and output,
B,
brushing the client's teeth,
C,
taking the client to the bathroom,
D,
assisting the client to call family members. Correct answer, C. Taking the client to the bathroom. Taking the client to the bathroom will most likely prompt a bowel movement, which supports GI tract health. A confused patient may not remember what the urge means. The client asks the nursing assistant to assist her to cut her toenails. The nursing assistant knows this client has type 2 diabetes. Which of the following actions is best?
A,
Retrieve a safety clipper and hand it to the client.
B,
Report to the nurse that the client needs her toenails trimmed.
C,
Check the client's blood glucose before cutting her toenails.
D,
Check the chart for physician orders regarding nail trimming. Correct answer. D. Check the chart for physician orders regarding nail trimming. Diabetic clients often have special instructions regarding nail trimming. Check the chart for specific orders. Which of the following options is the best method to prevent insomnia?
A,
Ensure the client eats 1 apple per day.
B,
Encourage the client to take several naps daily.
C,
Encourage the client to take several walks around the facility daily.
D,
Encourage the client to remain in bed throughout the day. Correct answer, C. Encourage the client to take several walks around the facility daily. Walking and physical activity during the day promotes rest and well-being at night. The nursing assistant takes the temperature of an elderly client and finds it to be 100.6 degrees Fahrenheit. The client reports having just taken a sip of hot tea. Which of the following actions is appropriate?
A,
The nursing assistant waits at least 15 minutes before retaking the temperature.
B,
The nursing assistant records the temperature in the chart.
C,
The nursing assistant scolds the client for not letting her know beforehand.
D,
The nursing assistant takes an axillary temperature instead. Correct answer, A. The nursing assistant waits at least 15 minutes before retaking the temperature. Waiting 15 minutes ensures the temperature of the mouth will be more accurate. Axillary temperatures in the elderly are often not the best measure. A client under the nursing assistant's care suffers from chronic foot drop. The nursing assistant can expect to find which of the following devices in the client's room?
A,
A wedge,
B,
a mechanical lift,
C,
positioning boots,
D,
2 extra pillows. Correct answer, C. Positioning boots. The boots will ensure that the feet are dorsiflex to prevent contractures and discomfort. A nursing assistant takes the blood pressure of a client and finds it to be 82/43. The client reports feeling dizzy. The nursing assistant should
A,
take the client's pulse next,
B,
report the finding to the nurse,
C,
record the vital sign in the chart,
D,
instruct the client to drink more fluids. Correct answer, B. Report the finding to the nurse. It is very important to report a symptomatic low blood pressure to the nurse for further investigation.